my name is Brianna. I'm a student physical therapist assistant, and this is my hot pack, cold pack skills check. So I'm gonna start this. I'm in the clinic right now, so I'm just gonna use what we have here just to demonstrate that I know how to prepare everything. And then I will be doing my demonstration with Maggie at her house later. Schedules just kind of conflicted at all kinds of different ways. So this is what we're doing. For my cold pack, I'm just showing like how to prepare it. So this is actually a flannel pillowcase. So it's pretty thick. So we count these as like 2 to 3 layers depending on the pillowcase in the clinic. So I will only be using that one. So I have this cold pack. I just pulled this out of the freezer that we have. And I'm just gonna put it in there. And I just fold this over. And then that's ready to go on my patient. My name is Brianna. I'm a student physical therapist assistant. I'm going to be working with you today. How are you?
I'm good.
Alright, so I understand you're having some wrist pain. You had an injury is what I heard?
I did. I was ice skating and I fell and caught myself on my wrist.
Okay, yeah, that's not good. Alright, so it looks like you have some inflammation. Do you have any pain with that?
Like a little bit of pain, but not too bad.
Okay, yeah. So on a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever experienced in your life, how would you rate your pain?
Probably like a 3.
A 3? Okay. So what I'm going to do with you is I'm going to go ahead and I'm going to ask you some questions, and then I'm going to put an ice pack on you, see if we can't get rid of some of this inflammation you have going on, and see if we just can't make that more comfortable and get you down from a 3 with your pain, and we'll go from there. So I'm just going to ask you some questions. So have you ever been diagnosed with something called Raynaud's disease?
No.
Okay. Do you have any circulatory problems that you're aware of?
No.
Any issues with your hands or your feet turning purple or anything?
No.
All right. Do you have any issues with like your blood becoming like gel with a cold application? All right. And then this one's kind of weird. Have you ever had blood in your urine after a cold application? No? Okay. And then last one, just have you ever had any hypersensitivity to cold? Any like rashes, wheals, redness, increased pain? Nothing like that? Okay, awesome. So it looks like you're good to move forward. So I'm just gonna have you sit back and get comfortable. And then I'm gonna stick some pillows under you, get you elevated. How's that?
Great.
Alright, now I'm gonna put this ice pack on you. I'm just gonna wrap it around this wrist. Like that. And this. Alright, so I'm gonna leave you here for 5 minutes with the call bell. If I'm gonna come back and check your skin after 5 minutes, if anything starts to feel weird, if your pain increases, and if you feel any burning, any type of weird sensation, please let me know. So I'm gonna leave you with the call bell.
Okay.
And I'll see you in 5 minutes.
Alrighty.
Alright, 5 minutes is up. Alright, that looks good. Nothing crazy going on. Alright, so now I'm just gonna leave you for another 10 minutes. If you start to go numb after a little while, that's completely normal. Again, let me know if anything weird starts to happen.
Okay.
Alright. And then for this one, so I just pulled the hot pack out of the hydroculator. It's probably colder now because I just did that. So I have my hot pack, just came out of the hydroculator. I also have this Dynatronic like towel wrap thing. This one's kind of newer, so I'm gonna go ahead and count it as 3 layers because it's still kind of like plush. We just opened this one like 2 weeks ago, I think. So that's why I chose this one. So I'm just gonna place my hot pack in the center of that, like this. And then I have just these blue towels that we have in the clinic, and I'm just going to fold that in half. So I have 3, 4, 5, and then another towel that I'm just gonna fold in half. and then 6, 7. And then it has these Velcro things here, so I'm just gonna go like this. Like that. And then I would flip it over this way, and then it's ready to go on my patient. Alright, my name is Brianna. I'm a student physical therapist assistant. So we just finished our treatment. How are you feeling after that? How would you rate your pain? 0 being no pain at all, 10 being the worst you've ever had.
Probably like a 5.
A 5? Okay.
Pretty sore after today's treatment.
Okay. Alright, so is everything still feeling kind of tight?
Yeah.
Okay. Alright, so what I'm gonna do now is I'm gonna apply a hot pack to you. I have a few questions and I have to check some things first.
Okay.
But we're just gonna do that, see if we can't get that loosened up so it's not so tight, and then increase some blood flow so that we can get some healing going.
Ready?
Alright, so first, do you care if I check your skin?
No.
Alright, so I'm just gonna check for any breaks or bruising in the skin, which you don't have any, so that's great. And then do you feel this?
Yes.
Okay. And then do you know what day it is?
It is Sunday.
Okay, and then do you have any history of cancer?
No.
Do you have any history of blood clots?
No.
And then have you had any recent bleeding or anything like that going on?
No.
Okay. Alright, so you're good to move forward, so I'm just gonna have you lay down on your side. Perfect. Alright, and then I'm gonna stick this behind your back just so you're not rolling all over the place. And then here. Alright, so I'm just gonna put this hot pack right here. How is that?
Feels great.
Okay, so I'm gonna leave that here for 5 minutes. I'm gonna come back and check you after 5 minutes, check your skin, make sure everything's looking okay. If anything starts to feel, if it gets really, really, really hot, I need you to let me know. I'll be back in 5 minutes to check you, and then we'll go from there. Okay, 5 minutes is up. Alright, so nothing's going on with your skin, everything looks good. And then I'm gonna leave you here for another 15 minutes. Your call bell is right here, and here's the timer. So
Alright.
I'll see you in 15 minutes.
Sounds great.